Having too much lower back curve can be a problem if it's legitimately there, but all too often people get told they have a lordosis and that this is the cause of their back pain and they need to flatten out that curve and make sure that their back is nice and flat. Well, this couldn't really be a worse bit of advice, especially if we don't know objectively what is going on. In this video, we're going to talk about all of that and much more so you know exactly what you should be doing and what the consequences of actually having too much curve in the lower back can be. If you do find this video helpful, then consider giving it a thumbs up. And if you stay all the way till the end and really get value out of this video, then consider subscribing to the channel because we have plenty more videos just like this one. So we really wanted a video that was going to be quite broad. So there's going to be a few different concepts in this around the topic of the lower back curve and what exactly is going on there. So you can have a look through the various parts of this video and that will probably give you a guide or a cue for more investigation, whether it's too much curve in the lower back being associated with anterior pelvic tilt and the consequences there, whether it's actually the illusions that can be created to make you think you've got too much lower back curve, a little bit about the SIJs, the sacroiliac joints, and how they contribute to too much curve, and really just a few different concepts that will hopefully give you starting points for further investigation to better understand your back, because the better you understand what's going on in your body and passing out some of the misinformation, the better you'll do in terms of fixing that back pain effectively. First and foremost, let's talk about that lordosis and what is it? Well, we should have a nice smooth backward bending curve, this being the back of the spine, your belly being over here. We're going through the lumbar region. As we go up through the spine, we should have a kyphosis, a forward bending curve in the thoracic spine with our rib cage and our heart sitting here and our lungs sitting here. And then at the top of the spine in the neck, we should have another lordosis. So first and foremost, we should have a lordosis. The question then is it a hyper-lordosis, a normal lordosis, or a hypo, meaning too little, a flattened lumbar curve? So when it comes to the lordosis, really there's only one way you can accurately establish it, and that would be with a standing up x-ray. We can measure the lordosis, taking a snapshot, a photograph of your spinal alignment, and then measure it and compare it to baselines. However, most of the time people come along this video because they've been told by some physical therapist, osteopath, chiro, a friend has told them in the gym, you've got too much lordosis or you've got a lordosis. And the implication there is that there's a hyperlordosis from a physical observation. The problem with these physical observations is there are a whole host of different things that can create the illusion of a hyperlordosis, too much curve in the lower back. And we'll get onto what this means for the structure of the spine later on in this video. But things like glute development. Do you have particularly large glutes? Have you got strong glute development? Well, that can allow the soft tissues to sit back over here, creating the illusion of more sweep in and an illusion of that hyperlordosis. The second thing is, have we got fat tissue lay down here versus here? Maybe we've got less fat tissue in the trunk and more in that glute region. That can also create the illusion. Also, how we choose to stand at that particular moment. Things like sway back posture, where we tilt everything backwards. That can create again the illusion, and that's not statistically an increased curve, it's a reorientation of the whole spine as a unit from the pelvis, not a hyperlordosis. And then we can actually have the hyperlordosis itself. That is where we have too much curve. But there are so many different surface illusions that can be created, which can lead us to think we have a hyperlordosis, when in actual fact, that's not the case. And if we treat it like a hyperlordosis, then we can make some of those other things that are lurking below the surface of the skin worse unwittingly. The big problem with this is that in most cases, it is an illusion. There is not actually a hyperlordosis there. And most people have a hypolordosis if they've got recurrent back pain. And do you know why? It's because think of the amount of things on a daily basis you are doing that cause that hypolordosis versus hyper. How many times are we sat slumped in a chair? How many times are we standing with bad posture? How many times are we maybe lying in bed or in the sofa, slouched like so? Our spine adapts to the way it's used on a daily basis, and there are very few activities that regularly reinforce the alignment of a hyperlordosis in daily living for most of us. Now, there are examples of things like gymnastics where we're doing lots of practice and we might develop a hyperlordosis, but the average person nowadays spends so much time sat in a hypolordotic position that it really is very infrequent that there is an objective increase in the lordosis. If we take this concept a little further, the normal spinal curves are developed as we're developing as a human being. And the changes in the spinal curves, where significant, are caused by repetitive strain day in, day out on those spinal ligaments that support the natural curve in the spine. So it's going to be repetitive actions that increase the backward bending in the spine that will cause the ligaments on the front of the spine to stretch a lot and adhesions to form on the back portion of the spine. And those activities are so infrequent. It's much more common that we find that there are soft tissue illusions created in and around the lumbar spine that make us think we have too much curve. And that results, unfortunately, in many people finding videos like this on YouTube, or maybe not this one, but other videos that tell them to do things like pelvic tucks, flatten that lordosis. That'll help you with your APT or hyperlordosis, and we'll get to that a little bit later. And those exercises, unfortunately, create a worsening symptom picture. They put more pressure through the discs, they destabilize the lumbar spine more, and they have impacts on the sacroiliac joints as well. And that is a real problem. And that's why we've done this video, to cover a few different areas that hopefully will give you ideas or avenues for further inquiry. The relationship between hyperlordosis and hyperkyphosis, this is something that we see, and it can also be co-occurring in things like scoliosis, which is a left-right shift in the spine, and that's something for maybe another video. But the hyperlordosis, if we take the spine and have a look at it and the consequences of that, it really becomes quite obvious how and why it's tied to a hyperkyphosis. So if we have a hyperlordosis, the spine, because of the way we work on a daily basis, standing up, it has to correct itself. So if we have too much curve down here, look at what happens to the top portion of the spine as I do that. We curve the back in, and this ribcage goes all the way back over there. Well, then what happens is we get a rounding of the thoracic spine, the kyphosis, a hyperkyphosis, this being a kyphosis, this being a hyperkyphosis, to accommodate for the hyperlordosis. And that is essentially, imagine we get this whole spring and we squash it down, all the curves become accentuated to counterbalance with one another. Now, there are some scenarios where this doesn't occur, and we'll cover those next. This next one is about anterior pelvic tilt, and this commonly does occur with hyperlordosis, or creating the illusion of hyperlordosis, and really it's just an anterior pelvic tilt. Now what we can have here is we take the normal lumbar spine, and if we tilt the pelvis anteriorly, that's going to have the impact of shifting the whole body weight forwards. And tying back to our hyperkyphosis example last time, here, instead of doing that, we actually get a hypokyphosis, which is where the thoracic spine straightens up a lot to counterbalance. Otherwise, you'd be toppling forwards all the time. Now, sometimes with this anterior pelvic tilt example, we can get over time a hyperlordosis to try and correct that. But this does take a good degree of time. And most of the time, someone's been told something, oh, stick your bum out, and they end up doing that. And they get this anterior pelvic tilt without the necessary hyperlordosis. But this is just another example of just not properly, accurately assessing what is going on at the level of the spine. And therefore we make these bad assumptions, these bad diagnoses, and these bad instructions to fix the diagnosis that was really a very poor one to start with. So what is the actual impact of having too much lordosis in the lumbar spine, a hyperlordosis? What you commonly find on imaging is that we have a significantly lesser degenerative change through these discs here, the lumbar discs, because we have substantially more pressure going through the facet joints. We end up getting the canal or the exit foramina where these nerves come out. You can see as we get a hyperlordosis, those holes get smaller, and that puts more pressure on the facet joints here, but also leaves less room as these nerves come out. So if we catch those facet joints, or they become a bit degenerative, there's less space for inflammation to build up before we start to get a problem, and that can lead us to a quite unfortunate set of circumstances. What essentially happens is a smaller, less severe injury will create a relatively small reaction, inflammation, etc., swelling in that region. But because there's such a small space, that creates disproportionate symptoms, and it can be quite sharp and unpleasant. Now, sometimes in these scenarios, if we also have anterior pelvic tilt, we can get a bit of uncharacteristic wearing of the L5-S1 disc, and this can also play into things like spondylolisthesis, where we get a shift forwards. But realistically, unless you're getting proper imaging at the time, you're not really going to find these sorts of things straight away. The final thing is how this ties into the sacroiliac joints. As we shift everything forwards into that hyperlordosis, we really do jam up and engage these sacroiliac joints, which is good for certain things, but it's not good to be that way all of the time. Conversely, if we have a reduced lordosis, which is an awful lot more common in long-term back problems, we tend to find that we disengage those sacroiliac joints, which makes them a little bit more vulnerable to straining them because they're not quite as engaged. So when we start doing lifting and twisting and other exercises or activities, they're more vulnerable to get strained and give you quite a good degree of discomfort. And that's not a sacroiliac joint problem. That is a lumbar spine issue, putting inappropriate strain or dysfunction through those sacroiliac joints. The reality of these things is there's a very, very good chance that you have a normal lumbar spine. You have normal alignment, maybe a little bit on the high side or a little bit on the low side, but statistically significance is highly improbable, or having a statistically significant increase in that curve is highly improbable. There's a good chance that it's just a little bit of an illusion from the surface, and really we have a fundamentally normal spine because that's what the research tells us. That's what's most probable. Now, if you do want to know for certain, then you can always get imaging done, but it has to be load-bearing imaging. A lying down MRI is not going to give you an accurate picture. So with all this in mind, what do? Well, the most important thing, leading on from last point, is to recognize that there is a very good chance, unless you've got categoric evidence to suggest otherwise, that you have a statistically significant increase in the curve. You want to treat your spine as if it is normal, and you want to focus on stability. That's going to be exercises that stabilize and strengthen the core, the ability for you to control your spine and control its movement and prevent erroneous or wry movements without having control over them. And we also want to build that strength up so we become stronger in not only this region, but its integration with the legs and integration with the muscles higher up in the back. That really needs to be your focus. And if you do all of that right, and don't worry about taking action to try and change parts of your spine, especially if there's such a great likelihood that that information is actually incorrect in the first place, you end up making things worse, unbeknownst to you, then you'll do very, very well. You'll be able to strengthen everything up, provide more stability for your lumbar spine, and really reduce the likelihood of you getting those back problems persisting for the long term. Hopefully you found this video helpful. Hopefully it's really given you some avenues for further investigation if you've been a little bit concerned about the state of your lumbar spine. Maybe you've got ongoing back problems, or maybe you've been told you have hyperlordosis, and some of these topics that we've mentioned, these illusions maybe, might really be relevant to you. Maybe you haven't even ever had any imaging to suggest that you do objectively have that increase in curve. And hopefully you've got a better understanding of actually most of us are normal. Most of us have a normal alignment. And if we start trying to change things on false information, we can unfortunately change things away from normal and make things substantially worse without really knowing what's going on. And hopefully you really just take hold, embrace the fact that you can do an awful lot of stuff to stabilize that lower back, provide support, provide strengthening, and really provide a long-term program to keep your back in a great shape, strong for the long term, and keep it where it is in that nice neutral position. So hopefully if you watched the video this far, you have found it helpful. You've got some food for thought going forwards. This is one of those videos which maybe leaves you with more questions than answers, but hopefully those questions will lead to answers further on, and the right answers rather than incorrect answers. If you did find it helpful, give us a thumbs up, consider subscribing to the channel, and do share this video with someone else that maybe has been talking about their hyperlordosis before. If you want to learn more about the premium Back in Shape membership, there's going to be a video somewhere underneath here. And if you want to stay up to date or tune into some of our more recent live streams and the Q&As at the end of those, then that's going to be down here. And remember, you can subscribe to the channel up here and hit the notification bell to make sure you know when we next go live, so you can join us for our next live stream and Q&A.